Emergency Management of Testicular Torsion, a short tutorial for Discover Pediatric Surgery by Nirav Patel, Marley Murray, Ellen Mapunda, and Hansraj Mangre. Testicular torsion is a common surgical emergency with devastating consequences if not detected and managed early. Torsion occurs when the spermatic cord twists, cutting off blood supply to the testicle. Torsion usually occurs in neonates and adolescents, but it can be seen in any age group. Early diagnosis and referral is essential to avoid testicular loss. Presentation depends on the age of the patient. Young children may present with a sudden onset of irritability, an inability to be consoled, vomiting, and a tender, swollen, and red hemiscrotum. Older children can present with a sudden onset of groin or scrotal pain that can radiate to the abdomen and may be associated with vomiting. On examination, these children can demonstrate a swollen, red, and tender hemiscrotum with loss of the cremasteric reflex on the affected side. Also, you can find an abnormally positioned testicle, with the testicle either being high riding or lying horizontal. Always remember to examine the groin in a male child with unexplained abdominal pain. It is extremely important to be able to clinically differentiate between a testicular torsion, an incarcerated inguinal hernia, and epididymal orchitis. Children with an incarcerated inguinal hernia usually present with a history of intermittent groin swelling on the affected side, with the swelling now being firm and painful. Those with epididymal orchitis usually present with a history of dysuria, cough or fever, and a slower, more gradual onset of pain in the affected side. They may also demonstrate nitrites, leukocytes, blood, and protein on their urine dipsticks. Any child with sudden onset of scrotal pain should be referred to a specialist center immediately. It is not necessary to send these patients for abdominal X-ray or ultrasound, as these investigations may delay definitive care. Rather, take a good history, perform a thorough examination and appropriate bedside investigations to determine the most likely diagnosis. You can start immediate management by giving analgesia, keeping the patient null by mouth, giving intravenous fluids, keeping the patient warm, performing the appropriate bedside investigations, counseling the parents and the patients on what is happening, and expediting referral to a specialist pediatric surgical center. Any delay to seeking and receiving care in testicular torsion can be disastrous. A good history, thorough examination, and appropriate bedside tests are usually all that is required in order to make the diagnosis. You can start early and appropriate management. Don't send the patient for unnecessary investigations, and expedite referral to a pediatric surgeon. Unnecessary delays can result in irreversible and devastating loss of the affected testicle. Thanks for listening, and please visit the Surgeons for Little Lives website or the Discover Pediatric Surgery YouTube page to download and share this and similar tutorials for free.